Imagine a world where all vaccines suddenly cease to exist. What would that look like? Now that's a chilling thought. Take a moment to ponder on it. Vaccines, these tiny vials of liquid, have played a monumental role in shaping our world, in maintaining the health of our societies. They are the invisible heroes, warding off an army of diseases that once crippled and claimed lives by the millions. In the grand scheme of things, vaccines are our protective shields. They keep at bay infectious diseases that we've long forgotten. Think about polio, measles, whooping cough, and so many more that have been largely eradicated thanks to vaccines. These concoctions have not only saved lives but also improved the quality of life for countless individuals. It's hard to fathom a world without these vital health defenders. Vaccines have been an integral part of our health system, so a world without them would look drastically different. In the immediate aftermath of stopping all vaccines, disease rates would start to climb. Picture this. The world just stopped all vaccinations. What would happen next? The answer is simple and chilling. We would see a steady and then sudden increase in preventable diseases. Let's talk about measles, whooping cough, and polio, three diseases that have been largely controlled thanks to vaccines. Measles, a highly contagious disease, was declared eliminated in the United States in the year 2000, but without the measles vaccine, we would be back to square one. Before the vaccine was introduced in the year 1963, there were an estimated 3 to 4 million cases of measles in the US every year. Then there's whooping cough, another highly infectious disease. Vaccines have reduced cases of whooping cough by about 80 to 90% compared to the pre-vaccine era. But again, without vaccines, we'd see those numbers start to creep back up. And what about polio? This crippling and potentially deadly disease has been eradicated in most parts of the world thanks to vaccines. Without the polio vaccine, we could return to the mid-20th century when polio outbreaks caused more than 15,000 cases of paralysis each year in the US alone. These diseases don't just affect individuals, they can spread rapidly within communities, leading to outbreaks and epidemics. The more people in a community who are unvaccinated, the faster these diseases can spread. And it's not just the unvaccinated who would be at risk. Some people can't get vaccinated due to health reasons, and they rely on others being vaccinated to keep them safe. A concept known as herd immunity. Without vaccines, we would see a resurgence of diseases that had been nearly eradicated. So, the immediate consequences of stopping all vaccines? A world where preventable diseases become common once again, where outbreaks and epidemics are the norm, and where the health, well-being, and lives of millions are at risk. Beyond the immediate, the long-term effects of stopping all vaccines would be catastrophic. Let's paint a picture of this grim reality. Imagine healthcare systems around the world strained beyond capacity. Why, you ask? Because disease rates would skyrocket. Without vaccines, common illnesses like measles, mumps, and whooping cough would make a massive comeback. Hospitals and clinics would be overwhelmed with patients, the likes of which we haven't seen since the pre-vaccine era. And it's not just about the diseases we know. The potential for new disease strains to develop and spread would increase dramatically. Without vaccines, our bodies would be more susceptible to infection and less able to fight off these new strains. This could lead to the emergence of superbugs, bacteria resistant to most antibiotics, and other diseases that we're currently unequipped to handle. Now, let's talk about mortality rates. Without the protective shield of vaccines, more people would fall victim to preventable diseases. Life expectancy, which has been steadily increasing over the past century thanks to medical advancements, would take a nosedive. Children, the elderly, and those with weaker immune systems would be particularly at risk. It's a grim picture, isn't it? Economically, the costs would be astronomical. The resources needed to treat all these preventable diseases would drain healthcare budgets. And it's not just about the money spent on treatment. Think about the productivity lost when more people are sick and unable to work. The ripple effects would be felt across all sectors of the economy. Societally, the impact would be profound. Communities would live in fear of outbreaks with the constant threat of disease hanging over them. The progress we've made in public health over the past century would be undone, setting us back decades. The long-term effects would change the face of health as we know it, with a significant increase in sickness and death. This is a world none of us would want to live in. It's a sobering reminder of just how crucial vaccines are to our health and well-being. But the impact wouldn't just be on individual health, it would be global. Imagine a world where diseases, once kept in check by vaccines, now run rampant. The health of populations worldwide would decline and the potential for pandemics would skyrocket. Diseases know no borders. Without vaccines, they would spread rapidly, causing international health crises. We've seen this in the past. Remember the Spanish flu? It claimed millions of lives worldwide. Now imagine that scenario, but with multiple diseases simultaneously. But the fallout wouldn't stop at health. Economies would also feel the pinch. As the population gets sicker, workforce productivity would plummet. More resources would need to be redirected to healthcare, straining already tight budgets. Economies could potentially collapse under the weight of a health crisis of this magnitude. In short, a world without vaccines would be more than just a health disaster. It would be a global catastrophe. Stopping all vaccines would not just affect individuals, it would have a profound impact on the world. Stopping all vaccines would have consequences that are hard to fully comprehend. The unseen implications are vast and far-reaching. Imagine a world where diseases thought to be relics of the past return with a vengeance. Not just globally recognized threats like measles or polio, but also illnesses we've largely forgotten, like diphtheria or whooping cough. The ripple effects would extend far beyond the immediate impact on our health. An increase in disease rates could lead to a strain on healthcare resources, economic instability, and even societal unrest. The return of these diseases could also have a devastating effect on our global community, creating health crises in regions that are already struggling. Vaccines are not just about preventing a single disease. They're about maintaining public health, keeping our communities safe, and ensuring a stable future. In a world without vaccines, we would be stepping back into a time of greater illness, death, and uncertainty. Vaccines play a crucial role in our health and in the health of our world.
Don't forget to like, subscribe, and share this video. That's all for Nifty Narrations.